Dr. Don Show. It's your health, it's your life on the Astral Radio Network. Now, back to the show.
Well, we started talking with some missing limbs, and then we are now into missing teeth, and we're talking with Tanya Little of Envision Denture. And actually, if you're listening to us, we want you to call Tanya and ask her some questions about denture use and denture care, and anything at all about the dentures you may have or you think you may need. Also, while you're listening to us, you can also go to her website, www.envision, envisiondenture.com. And as soon as you type it in Google, it'll get close enough, and you'll go to her website, and you can check out some of the things we're talking about and give her a call and ask her questions. So, Michelle, you had some thoughts about dentures?
Yeah, we were talking before the break about foods and how some people adapt what they're eating when they have dentures or when they're considering dentures. What other kinds of life changes can one expect if they jump to having dentures?
Well, I think the biggest thing when it comes to anything with your teeth is, you want to be proud of your smile. It's the first thing that people see when they look at you. And I mean, that's one of the most rewarding things about my job is transforming people's smiles. And, aesthetically, there are gender-specific teeth available now for patients who wear dentures. There's actually molds designed for females and molds designed for men. These denture teeth are designed to replicate natural teeth, and all the layers that we have in our own dentition. So aesthetically, the self-confidence is huge.
Well, for listeners, we really do encourage you to go to Tanya's website right now, because I'm looking at some of the pages that we printed out for the show here, and apart from showing you where the clinic is and talking about dentures and whatnot, you're going to see some very, very interesting things about teeth before and after dentures. And I can't help but think that some of these people just had a huge life-changing experience when they were, when they were fitted with dentures. Because when you look at all the situations our teeth get into, I mean, gosh, that could be a problem for 2 years or even 15 or 20 years before the dentures are in.
Yeah, absolutely. I mean, and that's, there's so many things complex about the mouth, with your bite position, that the teeth can get damaged, and, ultimately the bone underneath that supports those teeth get damaged. So, I really encourage listeners to see their dentist or denturist annually. April is Dental Awareness Month, and go get your mouth checked.
Now, a lot of people are maybe thinking about getting dentures down the road. Some of our listeners are not 20 and 30 anymore. It's we don't play rock and roll at 7 o'clock at night. So we're appealing to an audience that may be looking after people, their parents, with dentures as well. And that means that the person who's got the dentures is not always going to be able to make healthcare decisions. What would you be telling some of our listeners who are looking after their parents and relatives who need a little help with oral care?
Yeah, I think it's important to remember that your body changes, and it changes enough over a year to have your tissues looked at, first of all.
A year?
Yeah, I mean, it's professionally recommended to see your dentist or dental care provider once a year to have your tissues examined and or your teeth. But also the gums that support the dentures change over the years, and it's professionally recommended to have your existing dentures relined or refit every 3 years and replaced every 5 to 7 years.
Now, just tell me a little bit about this relining business. I mean, I can think of relining my car tires, but how does that relate to a pair of dentures?
Well, when a set of dentures are made, they're made to the way your mouth is. If I were to make you a set of dentures today, Don, they would be made to the way your mouth is today. In 3 years, your body's going to go through some changes, and the dentures aren't going to fit as they did today. So we refit them. We take a new impression. We refit them to the way your mouth is 3 years from now and give you a proper, healthy fit. And then, with the wear on your gums and the wear on the teeth, professionally recommending changing the whole denture every 5 to 7 years.
Now, I'm not in your profession, and your profession is a regulated health profession, just like physicians and dentists, nurses, and chiros. But when you talk about, so I'm going to ask some stupid questions here because I'm not in your field. What about this sort of appearance of shrinkage of the gums? Like, if you pull out all my teeth,
yes,
does my jaw, my gums actually shrink?
Well, yeah, I mean, you can, I mean, lots of people who are missing, or listeners are missing one tooth. They know that when that tooth comes out that there's a socket there.
Right.
And essentially that root is coming through the bone through the tissue, and there's a groove there. So what happens is the bone cells that were clinging to that root, they will transfer to the other teeth, and so that gum bone now is going to be shrinking up or shrinking down. Alternatively, if you're missing all of your teeth, the height of your bone is going to begin to resorb over the years. And I see patients who've been toothless for 30 plus years, and their mandible, their lower jaw, it gets to be within millimeters. And it makes it really, really, really difficult to wear a full lower denture. It's a disability, really. And that's
So
where
am I gonna
dental
get a
implants
pointy
come
chin?
in. Yeah, I mean, what happens is if you don't have that facial support that you had when you had your own teeth, you'll see people walking around and their chin, the vertical space that comes from their chin to their
absolutely.
nose, it comes close. You get that witch-like appearance. And so, properly fitting dentures will lengthen your profile and give you that facial support that you're missing.
So what about people that are looking after their parents or relatives? What should they be watching out for to make sure that the person's dentures are in good shape, they're using them properly? What are some of the signs that there's a problem or there's something that needs to be done?
Yeah, I think it's good to not be afraid to look in the mouth, because there's 1,000 people every year pass away from oral cancer. It's a very scary
Yeah.
statistic.
Yeah.
People need to have your mouth looked at. You can assess the dentures by taking a look at them, seeing if there's any cracks. You want to pay attention to the fit of the dentures and how they're sitting on the gums. If you put them in, are they falling out? That's an unhealthy fit. Any sort of a bunch of tissue, hyperplastic tissue that can develop.
What do you mean hyperplastic tissue?
Well, if the denture is ill-fitting in the mouth, what will happen is it will sit on the tissue, and
Yeah.
it causes an overgrowth.
Like a scar or like a what's the word I'm looking for? Callus.
Yeah, absolutely. I
So
mean,
a callus on my gum just
yeah.
because of the bad fit.
Sure, and I mean it can
That's gotta
damage
hurt.
the underlying bone and the tissue. I see it every day. One thing that you want to look at is the quality of the teeth. If you make a fist, you want the teeth to have grooves on it like your knuckles. As that becomes flatter and flatter like the countertop,
Yeah.
you're not getting the function and the digestion that you need.
Now, one of the things that is common in healthcare too is that when the patient is seen for the first time by whatever health provider they're going to, there's sometimes a question of dentures. Or do you wear dentures if it looks like the person might be?
Mm-hmm.
Why is that an important question from your view?
If the patient is wearing dentures,
Yeah.
If they're entering a healthcare facility.
Yeah.
Well, I mean, it just all boils down to nutrition. I go to the hospital once a week to see patients, and there's options there for people to come in and like myself to come see your family member. Dental care is not resistant to hospitals. And ultimately that's when you're going to need the nutrition and the digestion to keep strong.
Well, you just mentioned an early important thing, rather, and we're going to get to the issue of what foods you're eating before and after the denture use. But you mentioned you're going to hospitals. So it strikes me that your profession and yourself and your clinics especially may have to be making some tours to some of the residential care areas, because these residences, however, can't always have convenient transportation to come to you. So how much of that is part of your practice?
Yeah, I mean, I try and it's on as needed basis. I'm in contact with some nurses at some hospitals out in the Fraser Valley, and it's as needed. But I really think that the family needs to get out there and get to the dental professionals. I saw a lady last week. She was really begging me to kind of help her with her teeth, and she actually needed some extractions, and through the hospital, they don't actually have a dentist that will come in to do that. And I don't know if it's politically based, but it's the family's responsibility to have the residents or the patients.
Kind of like an outpatient service.
Yeah, yeah.
So we talked earlier in the break, and this kind of goes to the food issue, like implants. Now, I'm aware that people are getting implants and they drill them into the bone. And so how do implants and dentures work together?
Well, as I touched on earlier, when the tooth root comes out, you're losing that root there that holds the bone cells.
Right.
And when an implant is placed, it's essentially an artificial tooth root. And that's what it looks like. It's
bone
kind of
will
a tapered.
regrow around that?
Absolutely. The bone cells will osseointegrate or grow and preserve. And that is key here for dentures over implants, is the preservation of the gums.
So with the preservation of the gums, this is important for fit, because if otherwise they're going to shrink or do other things too.
Yeah, I mean, essentially, when you're losing all your teeth, the bone is just going to resorb. It's just going to continue to dissipate. And when the implants go in, it's preserving the bone because it's growing around the implant, and then we would fit the denture over the implant so that it's not moving around in the mouth.
Now, what about food? When a person gets dentures, how long before they can feel comfortable to eat properly? So person goes in, they have a couple of teeth missing, you give them a partial denture. That's probably not going to be such a big change for their face and their eating habits. But someone who's going in for a full upper or full lower or both, how do you transition them from no teeth to dentures?
Yeah, so if a patient's going to be having all their teeth extracted, we would make them an immediate denture, and so essentially that will be prefabricated before the teeth come out, and the denture would go in right away. This is going to act as a big band-aid and help kind of mold the gums and clot and get them used to it right away. The first 2 weeks, I always say, are the worst because it's tender. But through the healing phase, we'll keep relining them and refitting them, and it's just progression, just trial.
So Tanya, I know there were a couple testimonials that I read on your website, but what are your customers telling you about their new dentures? Pardon me.
Oh yeah.
Well, you know what? Free of charge, 10 years younger. They look 10 years younger, and that's my go-to line for them. Yeah, we spend a lot of time and detail to customize them for them, and they look great. Yeah. Excellent. Not only can they eat, but they look great and self-confident.
So it's like a fountain of youth.
It is.
Well, they say a smile, I don't know what the phrase is, something about a smile, right? But I think some people, as you mentioned earlier, self-esteem, they're self-conscious, they don't have a good smile. And it can sometimes be also from just the teeth not having been properly formed or shaped. They may not have been able to get denture or braces as a youth, and they won't get them as an adult, so there's issues with their teeth. But let's go back to the person who's just got their first set of dentures. How long does it take for them to adapt so they can comfortably eat?
Well, I mean, I think it just depends on many factors. Depends on how old you are, how your health is, what is going on in the upper jaw or the lower jaw. I would say it's 4 to 6 weeks before the muscles kind of get used to having that mouthful feeling.
And what sort of diet restrictions do you give people as advice in the first 4 to 6 weeks?
Yeah, pasta, fish, some steamed vegetables, just softer foods initially, because it's a mouthful. If you're missing all your back teeth for many years and then you get all your molars and all your front teeth, that's an extra 14 teeth.
So that sort of cartoon picture of my teeth sticking in an apple when I pull the apple from my face, that's a myth. It's not going to happen?
Yeah, no, that's a myth.
That's a myth. Okay. So, Tanya, this has been fascinating, and I think we got to get you back here to deal with this a little bit more. I mean, whether it's for personal self-esteem, let's not forget that, if you can't chew your food, you're going to have long-term nutrition problems.
Absolutely.
And the need to look after dentures when you have them, whether it's yourself or your family, I think there's a lot more that we can talk about.
Yeah, I mean, dentures are an investment.
If you'd like to get in touch with Tanya or her colleague and their clinic, we're going to leave that information on our podcast here after the show. And if you want to look it up tonight already, its website is www.envisiondenture. That's envisiondenture.com. Just go into Google, type in Envision Denture, even if you spell it wrong. Google's smart enough that it'll spell it right for you. So, Tanya, all the best. I think the denturist profession is an extremely important one. We've all got teeth. They all need to work, and if they don't, then I need to come see you and get something else put in there so my face doesn't shrink into that little cartoon character that's running through my mind. Tanya, welcome. All the best, and we welcome you back another time. Thank you for being here tonight.
It's been a pleasure. Thank you.
You're listening to the Dr. Don Show, live on the Astro Radio Network. Remember, it's your health, it's your life. When we come back, we'll be talking with Rhonda Nixon.
The Dr. Don Show. It's your health, it's your life. On the Astro Radio Network. There's still lots more ahead.